When the multiple casualty incident overwhelmed Metro General's emergency department at 3:15 a.m., night shift nurse Sarah Mitchell automatically began triaging patients with systematic efficiency that impressed seasoned trauma doctors who watched her prioritize treatment with combat-level medical decision-making. The medical staff didn't realize they were watching a former Army Ranger medic who had learned trauma medicine in situations where quick decisions meant the difference between soldiers coming home alive or in body bags. Sarah Mitchell, 29 years old, had been working the night shift at Metro General Hospital for 18 months and 12 days, maintaining the same methodical attention to patient care and emergency preparedness that had characterized her 8-year career as a U.S. Army Ranger medic serving in some of the most dangerous combat zones in Afghanistan and Iraq. Every evening at 10 p.m., she arrived wearing standard hospital scrubs, carrying medical equipment and patient care protocols that she reviewed with military-level thoroughness developed during years of life-or-death medical operations. The hospital staff and regular patients knew Sarah as the night nurse who seemed to anticipate medical emergencies before they occurred, who somehow managed every aspect of overnight patient care while maintaining constant awareness of critical situations and potential complications. She had reduced patient mortality during night shifts by 23% and earned recognition from both hospital administration and emergency medical services for exemplary patient care and emergency response coordination. What people didn't notice was Sarah's automatic threat assessment as she worked throughout the hospital, the way she positioned herself with clear views of critical patients and emergency equipment, the way she organized her nursing duties with combat-level precision that went beyond typical healthcare requirements. Her approach to patient care was comprehensive and systematically sophisticated in ways that suggested medical training beyond normal nursing education. Sarah had chosen night shift nursing specifically because it allowed her to use emergency medical skills to save civilian lives in peaceful healthcare contexts. After 8 years of Army Ranger medical operations that had required her to treat combat wounds in conditions where mistakes could mean death for both patients and medics. Her Army career had begun in 2013 when she enlisted immediately after completing her nursing degree, initially planning to serve in standard military medical roles. But when she scored exceptionally high on physical fitness and psychological evaluations, recruiters had suggested she consider Army Ranger training, one of the military's most demanding specialties that combined advanced combat operations with battlefield medical expertise. Army Ranger training was among the most difficult programs the military offered. Nearly 2 years of intensive instruction that included everything from advanced combat medicine to tactical operations, survival procedures, and emergency medical protocols designed for treating wounded soldiers in active combat situations. Sarah had been one of only 12 female candidates to complete Ranger training successfully, and one of even fewer to serve operational tours in high-intensity combat regions. Sarah's assignments had included medical operations in Afghanistan, Iraq, and classified locations, where she had treated combat injuries during firefights, improvised explosive device attacks, and emergency situations that required providing life-saving medical care while under enemy fire. She had earned recognition for medical excellence and life-saving performance that had contributed to saving more than 200 soldiers' lives. Over multiple combat deployments, Sarah had participated in medical operations that included everything from routine injury treatment to mass casualty incidents, saving lives in conditions that range from relative safety to active combat zones. But the psychological pressure of years spent treating horrific combat wounds, always knowing that treatment delays could mean death, had eventually become overwhelming. When Sarah completed her military service, she had been offered positions with military contractors, emergency medical services, and trauma hospitals that would have used her combat medical expertise in high-intensity medical roles. But after years of treating combat injuries, Sarah had chosen night shift nursing because it allowed her to use medical skills to help civilian patients rather than treat soldiers wounded in warfare. Metro General Hospital served approximately 300 patients daily, including emergency cases, surgical patients, and long-term care individuals who required overnight medical attention and monitoring. Sarah's nursing responsibilities included all aspects of night shift patient care, with particular attention to critical patients and emergency response for medical complications. During her 18 months at Metro General, Sarah had developed comprehensive knowledge of patient care protocols, emergency procedures, and medical response coordination that impressed both hospital administration and emergency medical services with its accuracy and practical effectiveness for patient protection. "Sarah," said head nurse Jennifer Walsh during one of their regular staff meetings, "your emergency response capabilities and patient care coordination are exceptional. You seem to identify medical emergencies before they become critical situations." Mrs. Walsh, patient safety is important to me. When people trust us with their medical care, they should be able to focus on recovery rather than worrying about complications or emergency response. What Jennifer didn't realize was that Sarah's approach to patient care was based on combat medical principles she had learned for treating wounded soldiers: systematic patient assessment, continuous vital sign monitoring, and emergency medical procedures that had been developed for much more dangerous and complex combat medical situations. The night when Sarah's background was revealed began with a medical emergency that tested every aspect of her Army Ranger medical training. A drunk driver had collided with a family vehicle at high speed, creating a multiple casualty incident that would challenge the emergency medical capabilities of even the most experienced trauma team. The accident victims arrived at Metro General at 3:15 a.m. during the typically quiet overnight period, with minimal staff on duty but multiple patients requiring immediate life-saving medical attention. The collision had created injuries that ranged from critical trauma to life-threatening internal bleeding, creating a medical emergency that required immediate professional response. Sarah was conducting routine patient checks when the emergency alert sounded. Her Army Ranger medical training immediately activated. She assessed the incoming casualties, identified treatment priorities, and began implementing trauma protocols that she had hoped never to use again in civilian medical practice. The first victim was a 34-year-old father with severe chest trauma and possible internal bleeding, requiring immediate surgical intervention to prevent fatal blood loss. The second victim was his 8-year-old daughter with head trauma and potential spinal injuries, needing careful neurological assessment and stabilization procedures. The third victim was the drunk driver himself, unconscious with multiple fractures and respiratory distress that required immediate airway management. Sarah's response to the multiple casualty situation was systematic and professional, based on techniques she had learned for treating wounded soldiers in mass casualty events during combat operations. She assessed all 3 patients within the first 30 seconds, prioritized treatment based on survival probability, and began coordinating medical response that would maximize lives saved. Dr. Rodriguez, patient 1 needs immediate surgery for chest trauma, Sarah said calmly as she began advanced life support procedures. Patient 2 requires neurological assessment and spinal stabilization. Patient 3 needs airway management before we can assess other injuries. Sarah's triage decisions were flawless. She had correctly identified which patient needed immediate surgical intervention, which required careful diagnostic procedures, and which needed basic life support before further treatment could be attempted. Her systematic approach to the medical emergency was based on combat medicine principles that prioritized maximum lives saved over individual patient preferences. Sarah, how did you assess all 3 patients so quickly? Asked Dr. Rodriguez as he began emergency surgery on the chest trauma victim. Your triage decisions are exactly what I would have recommended after detailed examination. Dr. Rodriguez, emergency situations require systematic assessment and priority-based treatment decisions. I've had some experience with trauma medicine and emergency response. But the emergency medical team working alongside Sarah recognized that her medical response demonstrated capabilities beyond typical nursing training. Sarah, said trauma surgeon Dr. Lisa Chin as she treated the head injury patient, your trauma assessment and emergency coordination are exceptional. You performed systematic triage with medical precision that suggests advanced training. What's your emergency medical background? Sarah hesitated, the way she always did when people asked about her medical capabilities. Some training in emergency medicine and trauma response. I take patient care seriously. But emergency medicine physician Dr. Michael Torres, who had extensive experience with combat veterans, recognized that Sarah's performance suggested specialized military medical training. Sarah, what you did was combat-level trauma medicine. Your patient assessment, triage decisions, and emergency coordination indicate advanced military medical training. Are you a veteran? The conversation that followed revealed Sarah's Army Ranger experience and her reasons for choosing night shift nursing over careers that would more obviously use her combat medical expertise. Dr. Torres, I spent 8 years as an Army Ranger medic treating combat injuries and conducting medical operations in Afghanistan and Iraq. I retired and chose nursing because I wanted to use medical skills to help civilian patients rather than treat soldiers wounded in warfare. Dr. Torres understood immediately why Sarah's medical response had been so professional and effective. Specialist Mitchell, Army Ranger medical training is among the most advanced combat medicine education available. Your expertise saved these patients' lives. The multiple casualty incident that Sarah had responded to became the catalyst for conversations about how her Army Ranger medical training could benefit hospital emergency preparedness and trauma response throughout the medical system. "Sarah," said Hospital Administrator Robert Kim during a meeting the following week, "your response to the casualty incident was extraordinary, and I've learned about your Army Ranger background. Would you consider expanding your role to include emergency response coordination for our trauma department?" Sarah was initially reluctant to take on responsibilities that reminded her of combat medical operations, but the trauma coordination position offered a compromise between using her expertise and maintaining the peaceful hospital work that had been essential for her transition from military service. "Mr. Kim, I chose night shift nursing specifically to step away from combat medical operations." "Sarah, this wouldn't be combat medicine. We need someone to develop trauma response protocols and coordinate with emergency services to improve patient outcomes during critical medical situations." Sarah accepted the position as trauma response coordinator while continuing her night shift nursing duties at Metro General. The combination allowed her to use her Army Ranger medical expertise to improve patient survival throughout the hospital system while maintaining the direct patient care that provided meaning and satisfaction. Sarah's trauma response protocols for Metro General emphasized practical medical techniques that enhanced patient survival without creating fear or restricting access to emergency medical care. Her training sessions taught medical staff, emergency responders, and hospital administrators how to recognize critical situations while maintaining hospital environments that supported patient care and family comfort. "The goal," Sarah explained to hospital staff during one of her training sessions, "is creating medical environments that maximize patient survival and family support. Good trauma medicine should enhance patient care rather than create additional stress." Sarah's work with hospital trauma response led to her developing protocols that were adopted by hospitals throughout the state, improving emergency medical care for thousands of patients who required critical medical attention during life-threatening situations. 6 months after the multiple casualty incident, Sarah received recognition from both the American Nurses Association and the Army Ranger Association for developing civilian trauma protocols that applied combat medical expertise to hospital emergency management. But the recognition that meant the most to Sarah came from patients and families who had benefited from the trauma response protocols she had implemented. "Sarah," said Maria Rodriguez when she visited Metro General a month after her husband's emergency surgery, "the doctors told us that your quick thinking and medical coordination saved my husband's life. Our children wanted to thank the nurse who helped their father come home." "Mrs. Rodriguez, I'm just glad your husband recovered and that your family can stay together." Emergency medicine is about helping families through difficult situations while providing the best possible medical care. Sarah realized that Maria's gratitude reflected exactly the kind of meaningful work she had hoped to find after leaving Army service, using her combat medical expertise to save civilian lives while enabling families to stay together during medical emergencies. A year after the multiple casualty incident that revealed her background, Sarah had become the region's leading expert in hospital trauma response and was regularly invited to speak at medical conferences and emergency medicine events about applying combat medical training to civilian hospital emergency management. Her presentation at the National Emergency Medicine Conference focused on the principle that had guided her approach to hospital trauma response. Combat medical training provides systematic approaches to trauma medicine that can dramatically improve patient outcomes when adapted appropriately for civilian healthcare facilities. 2 years after saving the car accident victims, Sarah continued working night shifts at Metro General while also serving as trauma response coordinator for the entire hospital system and consultant for medical facilities throughout the Southeast. Her story was featured in Army publications as an example of how combat medical skills could be applied to civilian healthcare, inspiring other Ranger medics to consider careers that used their expertise to benefit civilian patients and community medical care. Today, Sarah Mitchell continues working as night shift nurse and trauma response coordinator at Metro General Hospital while also consulting with hospitals throughout the region. She still arrives every evening at 10 p.m., still maintains patient care protocols with systematic attention to emergency preparedness, and still treats civilian medical care as a serious professional responsibility. But she also develops trauma response protocols that save civilian lives, trains medical staff in emergency medicine techniques, and coordinates with emergency services to ensure that hospital facilities provide optimal medical care during critical situations. The trauma bay where Sarah coordinated the multiple casualty response displays a small plaque that reads, "Dedicated to excellence in emergency medicine." Sarah requested that the recognition honor medical teamwork rather than individual heroism. Sarah's story reminds us that Army Ranger medical expertise doesn't diminish when applied to civilian healthcare, it enhances. That combat medical training can improve hospital patient care just as effectively as it saves lives in military operations. That the same trauma medicine skills used for treating wounded soldiers can be used to save civilian patients during medical emergencies. The next time you visit a hospital emergency department, remember Sarah Mitchell. Remember that the medical staff caring for your family might have combat medical experience gained in conditions and situations you can't imagine. Remember that they might have chosen hospital nursing not because they lack other qualifications, but because they've found meaningful ways to apply extraordinary medical skills to serve civilian patients. Sometimes the most important medical operations happen not in combat zones or military hospitals, but in civilian emergency departments where former Army Ranger medics choose to use their expertise to ensure that the skills developed for treating wounded soldiers can be used to save civilian lives during peaceful medical emergencies. Sometimes the greatest medical expertise belongs to people providing routine patient care rather than conducting combat operations, people who've chosen to apply Army Ranger medical training to civilian healthcare, ensuring that the skills developed for battlefield medicine can be used to save civilian patients during critical medical situations. We need to recognize and appreciate the skilled medical professionals among us who've chosen to serve quietly, especially those whose previous service required saving soldiers' lives in combat zones so that families could safely receive medical care in peaceful hospital environments. Because true medical expertise doesn't disappear when military service ends, it just finds new applications. And sometimes the most valuable combat medical training involves not battlefield operations or military hospitals, but civilian emergency medicine that ensures the systematic medical skills developed for Army Ranger operations can be used to save civilian patients and strengthen communities through excellent healthcare that creates hope during medical emergencies and gives families the gift of time together.